So the term simulation kind of implies something quite technocratic, but this was actually 100 human beings in a room, a mix of frontline professionals, system leaders, and people with lived experience, recreating the scenario of a neighbourhood health service. The importance of creating realism so that we could allow people to really relax into the behaviours within the scenarios and to really experience what this new way of working would feel like, a way of connecting and a way of interacting, as opposed to a set of processes. In the first cycle, if you like, to do what might instinctively come naturally. And what that creates is almost a reworked version of current day, but then an opportunity for everybody to come together. And then in the second cycle, to try something new. So there was a day break between the two cycles. We encouraged people to go home, and Manal will remember this, to think of one thing to do differently the next day. And I think it's fair to say there was a real explosion in activity, purpose and connection through the second day, when people have had a chance to really experience their current world, then think about what things they want to try and do differently, and then to come back and to be in that safe space. What we say to people is there's nothing you can do wrong in this space. Just go with your instinct. If you think something will work, try it. Social prescribers, by the way, were overwhelmed in both simulations. So when you take away the constraints of normal life, link workers, so the first simulation commissioned link workers halfway through the simulation because they realised how essential they were. In the second simulation, the social prescribers were overwhelmed. Some of the patient-reported feedback in the second simulation was people specifically saying that having someone who acted as a custodian for their needs, and that could be anyone, it could be a psychiatrist, it could be a nurse, it could be a link worker, but just someone they had as a point of contact to allow them to interface with the system as a person, not as a sort of person being referred, made a huge difference. So obviously a referral is actually a product of two teams trying to connect with each other. If you're working together as a neighbourhood team, you don't need to refer because you're all in the same conversation. So we saw a massive drop in referrals in the second cycle, which was really exciting. In both simulations, the role of the VCSE was absolutely at the core. Literally a verbatim quote, "I didn't need to see a GP because my needs had already been met," which for what we were looking for was absolute gold. Everybody was talking about agency as we went through the whole process. And I think that what creative health does is it creates agency in everyone. It creates agencies in the individuals who are able to connect with a sense of self and to feel empowered. Ultimately, for me, creative health is about hope. Because when you're creating something, you are creating something that wasn't there before, whether it's an experience, whether it's something you draw or create. So that sense of agency ran through the whole experience. And I think that being able to really feel that in the room is hugely powerful.